Okay, it's 1:35. Would you like to get started, Madam Secretary?
Sure.
Okay.
Okay.
Good afternoon, everybody.
Good
Thank you very
afternoon.
much for coming. This is the Miami-Dade County Transportation Disadvantage Local Coordinating Board meeting. Today is June 10th. And our first order of business is conducting our public hearing. I'd like to call the public hearing to order. Our first order of business would be the approval of today's public hearing agenda, which consists of a program overview, a public comments, and then an adjournment. Before I do that, I see that there's some rules of engagement involved here. Madam Secretary, would you like to take us through that?
Yes. Well, since we're in this new online environment that is new for everyone, I'm going to read this to make sure everybody follow the instructions. And if you have any questions, just ask, and we're willing to help here. Since this is a public hearing that is being recorded and you've experienced any technical difficulties, please contact Ivan, or just, Ivan is our consultant who is helping us to manage the online meeting. He's in the meeting right now. He's listening to all of us. So if anybody has an issue, he can help us out to fix it. All attendees will remain mute throughout the duration of this meeting, except for the public comments period. If you wish to provide comments, please use the raise hand button on your GoToWebinar panel. To your right panel, you will have a little hand. So once you see your microphone on mute, please proceed by first providing your full name and then your comment. Your microphone will remain on mute until the comment has been fully addressed. Board members, in this case, it's us, the ones that we can see, the panelists, are encouraged to enable their web cameras and mute their microphones when not speaking. For board members only, to move or amend a motion, unmute your microphone, clearly state your name for the record, and propose or second the motion. The TPO clerk will record the action and verbally confirm your name. Open votes, such as approval of agenda, will be conducted by counting dissenting votes only. Board members in opposition shall state their name and verbally express nay. Resolution and other important votes will be conducted via roll call. So, is everybody understanding the rules? Any questions? Okay, well, this is our first time doing this, so I'm sure we will be fine. Okay, you can continue, Mr. Chair. Vice Chair.
Thank you very much, Deneen. As stated, I need to approve today's public hearing agenda. Can I entertain a motion to approve?
I'll give you a motion to approve the minutes.
That's Dr. Ken, I'm sorry.
Bro, yes.
Okay.
Dr. Kent, this is the public hearing agenda. Is that what you're motioning to approve, Dr.
Yes.
Kent? Very good. Do we have a second?
This is Cornell Cruz. I second.
Thank you very much. We have a second for the approval of the agenda. Any discussion? Anybody opposed? Thank you very much. Our agenda is approved. Next order of business is the Transportation Disadvantage Program Overview. And I'd just like to touch on some points of why we're here and why we're conducting this meeting. It's always good to refresh ourselves about the Transportation Disadvantaged Program. The Florida Commission for the Transportation Disadvantaged is an independent state agency, and it's administratively assigned to the Florida Department of Transportation, and it reports directly to the governor. The CDT functions independently of the control, supervision, and direction of the FDOT. the Florida legislature established the CTD to accomplish the coordination of transportation services provided to the transportation disadvantaged population. The authority of the CTD is derived from Chapter 427 of the Florida statutes and Rule Chapter 41-2 of the Florida Administrative Code. This was done approximately 1986 and 1987. So a big question always asked is, what is the TD population? The TD population is comprised of individuals falling into one or a combination of the following four groups: older adults, persons with disabilities, people with low income, and at-risk children. Individuals falling into one or more of these groups who cannot obtain their own transportation due to their age, disability, income, are eligible to receive transportation services funded through the CTD, so they may access medical services, work opportunities, educational opportunities, groceries, and other activities essential to achieving personal independence. And one of the main points of the CTD is to have a coordinated transportation system. And they do this by funneling down the functions of the CTD to the individual counties. And each county is responsible for approving and conducting its own coordinator, also known as the CTC, the Community Transportation Coordinator. And this is where the Department of Public Works and Transportation comes in, as they have been selected. And as far as I've been doing this, which is now 30 plus years, they have been the CTC for Miami-Dade County. And one of the other things that the coordinated system does is they have local boards to watch over and to look and approve the documents that the state provides to the county, and then the administering of the funds by the county on behalf of the state and the transportation disadvantaged population. So here is our board, the local board for Miami-Dade County. It comprises of representatives from all different divisions, as we know. We have folks from the DOT on board. We have elderly advisors. We have folks from the disability community. We have private transportation providers. We have the Medicaid program office representative. And that comprises the local board here in Miami-Dade County. Everything is different, as we know, in Miami-Dade County. So there's yet another caveat, and that is due to our generosity of our STS program, that is considered a sponsored trip, ADA-like transportation. And so CTD funds cannot be used for STS transportation services because that is a sponsored trip. The same with Medicaid program services. The CTD funds that we get from Tallahassee cannot be used to offset some of the Medicaid program costs in Dade County. So really, what we have is a concentration of our efforts with the TD dollars in what is the at-risk children part of the transportation disadvantaged population. And this is where our TD program efforts through the transit mobility program and the easy ticket program put their emphasis on. So part of our update today, we'll be hearing about exactly what's going on with those two programs, and we'll hear later more on that. Are there any questions about the TD program overview? Thank you very much. Are there any public speakers with any public comments here today wanting to address this board? Hearing none, I will adjourn the public hearing and go into our regular board meeting. Is that okay, Madam Secretary?
Sure, yes. We will adjourn the public meeting since we didn't have any public, we didn't receive, when we sent this through the newspaper, we asked for public comments to be sent to me prior, or if you join the meeting as a public member, you can give your comments right now, but since we didn't have anyone, so we can adjourn the public hearing portion of this meeting today. Oh, 146.
Okay. I'd like to call the regular board meeting of the Miami-Dade County Transportation Disadvantaged Local Coordinating Board, meeting of June 10th, 2020. Thank you, everybody, for attending. For those on video and those listening in, if we could just, I don't know how we're going to do this, but everybody just go around the room and tell us your name and where you're from.
Okay.
I still don't know how that can be done, but
I can probably do it.
Azor.
Okay, go ahead.
I'm sorry. My name is George Azor, and I'm the vice chair, and it's good to see everybody, and glad that we're meeting on this important topic.
Okay, my name is Janine Gaslonde. I'm the LCB secretary for the board. And now Maria.
Maria Hernandez with the Agency for Healthcare Administration.
Mia.
Mia Marin from the Department of Transportation and Public Works.
Gina.
Hi, my name is Gina Victoria. I am with FDOT District 6. I am the Passenger Operations Specialist with the 5210 program.
Okay, Mr. Cornell Cruz.
Cornell Cruz Jr., Executive Director at the Community Reinvestment Alliance of South Florida.
Okay, so now we can continue with other stuff that is in the line that we cannot see in the camera. I'm gonna be calling each one so you can introduce yourself. We have Ed Carson.
Good afternoon, Ed Carson with Miami-Dade DTVW.
Elizabeth Rockwell.
Yes, Elizabeth Rockwell, Miami-Dade TPO.
Yeah, Hillary Jackson.
Good afternoon, Hillary Jackson with the Agency for Persons with Disabilities.
Maria Hernandez. I know you already said, I'm sorry. Maria Elisa Amador.
Good afternoon, Maria Elisa Amador with the Agency for Healthcare Administration.
Okay, we have Paola Villanueva. Anybody here with Paola?
Janine, so
Yes.
the attendees are not able to speak.
Okay,
so
I'm sorry.
only under the staff, and also you have Dr. Chesborough, who is available.
Okay, so I'm gonna mention the names of the attendees, but they're not gonna be able to see present, but just for the recording. I'm gonna say Doug Bermudez, Maria Terry Vilches, Paola Villanueva, Robin Talas, and Rosa Yaguno, and Sylvia Jones. So I think this is all the attendees for today.
And also
Not
you
here, Roberta. Roberta's here.
Or, oh, okay, I couldn't see you in the list.
She's calling
For
in.
some reason. Okay, that's why. I'm sorry. Okay, Roberta, good. Thank you for name.
And also Dr. Chesborough.
And Dr. Ches, yes, he's here. And because I couldn't see him either. He's calling, right? Dr. Ken Chesborough. Are you here, Dr. Ken? Mr. Ken? I think he's probably on mute.
Unmute.
Yeah. Okay, I mean, I have him in the screen, so he's probably in the line. For some reason, we won't be able to hear. But you can continue, Vice Chair.
Thank you, Janine. First order of business is the approval of today's agenda. Any changes to the agenda, Madam Secretary?
No.
Okay. I'd like to entertain a motion to approve today's agenda.
Can you hear me now?
Yes, Dr. Kemp, I hear you.
Ken. I'm sorry, who seconded the agenda?
If somebody made a motion, I did not hear it.
I think Dr. Ken made a motion, right? Dr. Ken, are you there? I can hear him.
Okay, this is Cornell Cruz. I make the motion.
Okay, thank you.
Maria Hernandez,
Thank you,
I second.
Thank you.
We have a motion to approve. We have a second. Any discussion? Anybody opposed? Today's agenda is approved. Thank you very much. Next order of business is the approval of the minutes from the March 5th, 2020 meeting. We've had these sent to us in advance. Any questions or comments? I'd like to hear a motion to approve the minutes.
Dr. Kent Chesborough, I'll give you a motion to approve those minutes.
Thank you.
Thank you, Dr. Kent. Do we have a second?
Maria Hernandez, I second.
Thank you, Maria. We have a motion to approve the March 5th, 2020 meeting minutes. We have a second. Any discussion? Anyone opposed? Thank you very much. March 5th, 2020 meeting minutes are hereby approved. Once again, we entertain public comments. Any public comments today?
No.
No public comments? Okay. Moving right along. Action items. First order of business of our action items is the annual update of the fiscal year 2016 to 2021 Transportation Disadvantage Service Plan. This is a very lengthy document that you have received already in your packet and probably used several printer cartridges on. Working from home. Who reimburses that now? Okay, how do you get this printer cartridge reimbursed? This stuff is expensive.
I know, I don't print anything.
Office Depot. But they have someone in their staff that asks for hard copies in TPO.
Yes,
they do not read anything. They have to have a print copy, old school.
Understand. Okay, Mia, are you gonna talk about the TDSP and some of the changes that we have in the plan?
Yes.
Ivan, you wanna put the next slide? Just to make sure, okay, you have it there.
Yes, for purposes of this webinar, our meeting, I submitted to the TPO some highlights of this document. As George has already explained, it's a large document, so what I did was I identified a couple of the highlights, and along with each on this list here, the bullet, labeled it so where you can locate the actual section that I'm talking about in throughout the document. So first and foremost, the update includes we've had to add a COVID-19 section within the document, and that document is located in Appendix H all the way in the back, and it lists all the service adjustments that DTPW has initiated since the beginning of when we started the quarantine and the different phases. So the next thing is in the TDSP document, there's a trip generators section, and it's quite extensive, and that provides the different, I guess, locations where provides the larger, generation of trips, and that's located in Appendix C. We have we had to update. The TD. Hello, I'm getting some voice noise kickback. Okay, so for the TD Easy Ticket Program participating agent, it's located in Appendix E. We've also updated in this document the coordination contractors, the 5310 coordination contractors list, and that list is on page 29. Janine, I thought that every section that we would go in, it would go to that section of the document. I can't hear you.
Can you hear me now? Can you hear me now?
I can hear you now.
Okay. Everyone should be put in mute when one is talking, so we avoid this disruption of sound. And also, I just discussing with Ivan to put on the screen like we did yesterday in our practice.
Yeah,
so
that's
Ivan,
why I was wondering.
Yeah, me too. Ivan, please. So let's go from the first one. You know, the tabs that you had yesterday, Ivan. Okay. So the first one is the Appendix H that we added into the document. The COVID section is right there. Everyone has a copy in their package, in the agenda package, but I mean, at least you can see here, this is a section that was added, right, Mia?
Yes, so this is the Appendix H, and here it shows a listing of the service adjustments that have taken place. And this gets up on the website, on the bottom there, if you click onto that highlight on the Go Miami-Dade Transit web, it updates, I guess, as we move along on the different phases, how the service adjustments are modified, okay? So for the second bullet, which is the trip generators, you want to prompt? Yeah.
I mean, this is just the update of the list of the trip generators in reference to the last year document. So this is the updated list. You want to show Ivan down?
You know,
Yeah.
so they'll, here, stop 1 second, so you can see there's different, you know, the listing here of the different trip generators, you know, in the you know, I guess, you know, the map ID number 4, there's a downtown CBD, and then these are all the routes that follow that. So you can use that as a reference on that. So the next highlight is the update to the 5310 coordination contractors list on page 29, and there you have a listing of the 43 coordination contractors with the contact and the address. I'd like to thank Gina Victoria and helping me with this, because a lot of the time these coordination contractors, the contacts and the address changes, so this is all constantly year round. It's being updated. So okay, so for that, so the next one is there were one of the highlights identified was the minor updates to the TD program forms to adjust for the poverty levels of 150%, and that's in Appendix D. Yeah, okay. Yeah, that wasn't added. Yeah, I guess Appendix E was added there. That's the program participation for our TD program that Roberta can or Sylvia can discuss later. So for Appendix D, the transit mobility, there's some forms every year. The the poverty levels of 150%, they change every year. So the figure is for this year, for 2020, is 19,140.
Yes, we can see here the number. It's just a little delay in showing the document, but you can see here 19,140 for 2020.
Okay. So and the next highlight is the minor update to the bus route, and that's on pages 33 through 35, and you can see there the bus routes within, you know, the TD population. And then the final highlight is the service rate summary, and that's on page 38.
Correct.
And that concludes my my highlights.
Yes. Well, in addition to those changes, actually, you know, we also formatted the document to update the membership list and all, because we have new members, and we changed the period of their membership. So all of that has been updated in the document. You have a copy of the document with the track changes in the agenda package. You can go through that. But basically what we wanted to do today was approve the document, right? Mr. Azor? You're mute.
I'm sorry. Yes, this is an action item that requires approval from this board. As I spoke earlier about the Miami-Dade Department of Transportation and Public Works being the CTC, this is one of their very main functions. The update of the Transportation Disadvantaged Service Plan, as you could see in your package, it's a very thorough informational guide that tells us, if we take the time to read it, tells us a lot about what we do and don't do in Miami-Dade County, and we pretty much do a lot of things. So this does need our approval, so I would entertain a motion to approve the updated service plan.
This is Cornell Cruz. I make a motion.
Mr. Cruz has made a motion to approve the service plan. Thank you. Do we have a second?
Maria Hernandez, I second.
Thank you.
Thank you, Maria. We have a motion and a second. Any discussion on the disadvantaged service plan? I have a couple of questions, but anybody from the board want to ask some questions?
This is Cornell. I have a question, Ms. Marin. Is the added COVID-19 section going to be a permanent part of this plan?
I'm not absolutely sure. All I know is that once I initiated this update, I did consult with the CTD at the state level, and they wished to have included a COVID-19 section. So we did that. I don't, you know, I'm not sure. I guess I can, you know, I can follow up and see, you know, how temporary this section is. But for right now, it's on there, and you know, it's on a standby. Okay, and like I said, if I find anything, I'll follow up and notify the board of any changes. Thank you.
Thank you, Mayor.
Any other questions from any board members regarding our service plan? I just wanted to ask and thank you. It's a very well prepared plan, and as I said earlier, very thorough. It shows that we have 817 Metro buses out on the street, 136 Metro Rail trains, and 26 Metro Mover trains. Are any of these buses listed here private vehicles operating routes for Miami-Dade Transit, or is it strictly Miami-Dade Transit vehicles? I'm sorry, I still call it Miami-Dade Transit.
That is a good question. I do not know that I would have to get back with you, and I can follow up and send an email to Janine, and she can provide that. I would have to. I'm assuming that it's all plus it's our buses plus the contracted. But I just to be 100% sure, I would need to follow up with staff regarding that. I'll actually send an email out right now to see if maybe by the end of this meeting I can get a response. Okay.
Okay. Do we? And I'm sorry because I was not reading it thoroughly. I couldn't quite. If I didn't get to the section, I apologize. But do we list the STS vehicles there, or we don't do that anymore?
No.
All right. Any other questions? Any other discussion? We have a motion and a second for the approval of the TDSP plan. Anybody opposed?
No.
Hearing no opposition, the update of the TDSP is approved. Thank you very much.
Thank you.
Thank you.
Going into our information items. The first order of business is the TD program update. And who's going to do that for us?
Hi, this is Roberta.
Okay. Thank you, Roberta.
Good afternoon. This is Roberta Pasquier, Department of Transportation and Public Works, and I will provide the updates for our Transportation Disadvantage Program for the month of January, February, and March of 2020. This includes the number of agencies that have been enrolled for this each month, the total distribution for each program, CD Mobility and CD Easy Ticket, and the total value cost for both programs. Starting with January 2020, we had 60 enrolled agencies, 60 agencies that actually pick up Easy Tickets with a fair media value of $57,380.50. For the transportation mobility, transit mobility program, we have a total of $584,100. And for the both programs, the fair value, it was $641,480.50. For February 2020, we have, I'm sorry?
Hello?
Hi.
Roberta, I'm sorry. Hi, Roberta. I'm so sorry to interrupt you, but I know that she has we have the figures. Can we see the figures rather than just seeing this A here on our screen? Is that possible or no?
Yes, I was just requesting that right now. Not sure why it's not being put in there. Ivan, can you please update the slide? No, no, we need in the document, in the actual document, we have a tag that you did for the TD program update. Right there. No, the next one, Next one. Okay, that one right there. Thank you, Ivan. That's it. And it's, you have to roll down as she give the totals. Yeah, right there. Okay, that's
so
everyone.
Like me?
Can you please repeat, Roberta?
Sure, sure, I will do. So for January 2020, we have a total of 60 agencies that picked up the Easy Tickets. The monetary amount was $47,380.50. For the Transit Mobility Program, we have 5,192 active cards, totaling $484,100. And the fair media value for both programs was $641,480.50. For February 2020, we have 62 enrolled agencies. The media value for this program, the TD Easy Ticket, it was $60,324.40. For the Transit Mobility Program, the amount was $576,900. And the fair media value total for both programs, it was $637,224.40. For March 2020, it was 61 agencies. The value was $58,644.50. For the Transit Mobility Program, it was $562,387.50. And the total fair value for both programs, $621,032.
Anything else, Roberta?
No, sir.
Just to go back, the TD Transit Mobility Program is the annual Easy Cards. Is that correct?
Yes, that's correct.
And then the ticket program is, I guess, just the bus tickets.
Correct.
Okay. Now the March figures, I would have thought would have gone down because right around March 15th, March 16th, we had the emergency stuff and the stuff. A lot of things were shutting down, but I guess you had already sent the passes and stuff to all the agencies by then, so that's why we have these costs, right?
Correct. What we do is as of the 27th of the previous month, if it doesn't fall on the weekend or on the holiday, then the TD Easy Tickets are available for agencies to pick up their fair media since for them to start distributing to their participants, to especially those monthly passes that become effective the first of the month. So this fair media is usually picked up the last week of the previous month up until the 10th of the current month.
So would this be a correct assumption that in April, that is going to go way, way down?
Actually, it's going to be 0 because we did not conduct any distribution for the month of April.
Okay, so probably April and May.
In June. Mm-hmm.
So April and May will probably be next to nothing, if not even 0.
Mm-hmm.
Wow.
Okay. Any questions for Roberta on the TD program update? Roberta, thank you very much. Be safe.
It's my pleasure, sir.
Okay, information item B, 5310 grant update. And is that going to be Gina?
Yep.
Yes. All right. Hello. Good afternoon, everyone. I'm very grateful of being here. This is my first time doing this. And everyone hear me? Okay. Good. So this is my first time doing this, so bear with me. I'm not a very public speaker, but I guess I will learn. So thank you for your patience. So the updates that we have for the 5310 program, so we all know 5310 program provides capital and operational funding for nonprofit agencies to meet transportation needs for the seniors individuals with disabilities where transportation services are not proper or insufficient and unavailable or improper. Currently, and I would like to say that we have 50 active agencies, and based on the and I'd like to touch bases with the C-19 situation. We received direction from central office that all the agencies will have to submit a report updating their transportation, if they were providing or not transportation services. Of the 50 agencies, we're being receiving 27 reports. So not all of them are very punctual, or they are very proficient on providing updates every day. But at least we encourage them to provide us an update once a week, regardless if they have stopped their services or not. At least we have an update if the agency is still closed, or if they are providing transportation services or not, or if they are providing delivery of the meals or medicine. As of last week, we received a new direction from central office that now the agencies will have to submit their disaster/transportation updates via Transit 2. So we provided central office a list of the users that will have to be reporting this, and we have enabled or habilitated the option to add other users, so multiple persons can do it, because we know our 5310 agencies are mostly volunteers. So one day one person is there, and another day they change the stuff very quickly, so we have to accommodate. So that's that as far as the C-19 situation. More to be more. As part of the grant program, all the awards for the federal fiscal year 19 last cycle, all awards were claimed. We coordinated with central office, so all the agencies claimed their vehicles or their equipment. So that's good. The deadline to submit the orders was May 15th. So everyone is checked. For this cycle, we have a little bit of reduction in our budget. Last year we received 2.7 million, and this year we received 2.3. Luckily, we are on budget, and we received 10 capital applications and 8 operational applications. So adding up all the requests, it came up to 2.1. So we're very lucky to have all funds. We're going to have all the applications funded. So that is good, because that didn't happen last cycle. We had to do a full review, Janine. So that was a good experience, but we like to fund as far as whenever possible all the agencies, so give all of them a little bit. So that is what is happening. The tendency that we're having right now with the 53 Gen programs is that the agencies are now requesting more operational funds instead of vehicles due to the triennial reviews. Some agencies have a little bit of an issue or a problem trying to comply with all the requirements of the program, so they decide to not to enhance their fleet, but to have the funds so they can operate properly and hire another person so they can comply with all the requirements that I've been asking. We are in the middle of the review of this year. Our deadline to submit our suggestions or recommendations to grant this year funds is July 1st to central office. So I guess for the upcoming meeting, I'll have a more detailed information to provide. And that's it for the 53 Gen program. Any questions?
Any questions for Gina?
Gina, thank you. Very good. There is any chance you can send me like an email with the actual numbers of the applications, and just for my minutes to make sure I took a note, accurate.
Sure.
Thank you.
You're welcome.
Anything else for Gina? I have one question for Gina. Gina, what would be an example of a operational
application?
I'm sorry?
Yeah, what would be an example for an operational application?
Yes, instead of them going for vehicle funding, you said that they go for operational costs. What is an example of an operational cost?
Okay, so the difference between a capital and an operational, the capital provides funds to get the vehicle, so the agency customize the vehicle to their needs. And the operational funds provide funds so they can run their transportation program. So they can use those funds to pay, let's say, for the drivers to cover all transportation related costs. So they invoice the department, and then we reimburse whatever cost is eligible to cover under the 53 Gen program requirements.
So it could be payroll related. They say they have 2 drivers, and then they would submit their payroll records to the department for reimbursement.
Correct. So they will have everything that is transportation related, that is insurance, cost, payroll, paying for the drivers, paying for gas, certifications, trainings, all of that is transportation related.
Very good.
Did that answer?
Thank you very much.
Good.
Yes, absolutely. Thank you, Gina. Thank you for the update. Pleasure to have you on the board.
Good. Thank you for your patience.
Okay. Moving right along, we've got item 7, which is old and new business. Either Mia or Janine, I know we had we had some news about a possible new rate formula. If somebody would like to talk about that.
We can hear you. It's me.
Sorry. Yes, earlier this week, on Monday, the CTD had their business meeting, and as an informational item, they mentioned that they had published a allocation formula for the trip equipment, a study, and it's a study that will be initiating also workshops and to get feedback from the public to determine what type of new formula they would like to adopt. Apparently, over the years, the CTD has been, from the rural agencies, that this allocation, it doesn't really benefit them well, and so the more urbanized get a bigger, chunk of the pie. So they've tried to, they came up with a study many years ago, and then that study they proposed a formula, and that formula with the intended consequence didn't help all the rural counties. So they took it back, and then they reverted back to the old original formula. And so now they're back at the drawing board again. They want to initiate this, workshop, brainstorming to get and find an allocation formula more equitable for everyone. So this study that they published, proposed a couple of models, but again, those models are just a preliminary, and I reviewed the models, and none of the models benefit Miami-Dade County. It's still, from worse to worse. We're going to participate in these these workshops are going to commence. They were supposed to begin. They were supposed to start in the beginning of the year, but because of COVID, they had to cancel them. They're going to start resuming these workshops. The first one to be held at the end of this month, but it's going to be virtual. So in that meeting, they proposed, they sent out a link to that study, and what I can do is I can have Janine, I'll send her the link to that study to send to the LCB board to see if, maybe they have any suggestions or anything to be included as part of the comments and the public participation. Again, this process is beginning now, and they're not going to make a decision until next year. And if there is a new formula that's going to be adopted, it's not going to affect our current funding allocation that we have now. It would be for the 2021, 22 year, our cycle.
Yeah, I want to say something, Mia. I see we have in the line Dr. Teles, who's our commissioner that represents Miami-Dade County in the board, in the state board. I'm not sure if she can hear us and she wants to add something to this topic.
Hello, how's everyone?
Hi, thank you for joining.
It's so good.
How are you?
Really good to see you guys. I know that a couple things, I believe Robert Villar spoke, right, during the meeting last time. And I think his point was for them to consider that there are some counties that have ADA and funding and some don't, like we don't do anything with ADA, and to take that into consideration as well regarding the formula. He also, that was his main point. The other thing was, I like the fact that they are going to have these workshops. The one on the 26th is the first of many. I'm wondering, are you all scheduled to attend? It's from 9:30, it's the 26th from 9:30 to 12:30.
Yes.
Yes, I'm gonna send Janine the link. I think she may have it, but I'll send it to her, and then she can provide the information should any of the LCB board members wish to read the study and either participate in the future workshops, or on that website it has a section where you could provide comments, and they take those comments into consideration, and they actually post them. So the last time that I went onto the link, it it had a section where it already is adding questions and comments to that study already in the within a short period of time that it's been published.
I would really recommend that everyone take an opportunity. Are you going to send out the link, Mia?
Yes.
Okay.
Janine has it.
Yeah, I would, because it's very interesting how they are proposing. One of the things that I know that David Darm, the executive director, is looking at and wanted to take a really different approach to the formula, because the devil is in the details, and he's really looking at where they pulling the data from. So that's just a different approach, I think, than Cutter had. And there were some things from the Cutter program that were not explained. So I think you're going to see some fresh eyes, but I really want you to look at that report, because it does propose a different way of looking at things. So I don't know, Mia, you said someone was going to be looking at it, and maybe you can kind of see how those proposed changes would affect Miami-Dade.
Yes, what I can do is, for the next LCB meeting, I can dedicate a section and explain a part of the study. I mean, I have some highlights here. It is true, Doctor, that the first study provided by Cutter, they really, there's not too sure how or what they used as information to be able to then come up with the recommendations that they did, and probably the result was that the intended consequences, it was supposed to help the rural, and it did not. What I'm understanding is that this study, they're using actual data, data sets, like they're using it from the American Community Survey 5-year population data. They're getting it from the Federal Highway public mileage, road mileage data. They're using the AOR data from all the participants, all the agencies in Florida, and then the trip and equipment, the invoice data from all the agencies. So it's a little, and because the people that are doing the study now, I can't remember. George, you know them. You know the name of the firm. It's an accounting firm. So they're approaching this study a little more, from an audit perspective, and they're using actuarial. So it's a little more, technical in their approach to how they're going about this process.
Yes, and I can tell you, I have to thank Elizabeth, because one of the first things that I did when we had our new executive director come on board, which is David Darm. He's a millennial, and he has a definitely different approach. He listened. He actually looked. I mean, we presented that study before, that report before. Elizabeth has tried several times for people to listen. And he was the only one that really looked at that report and said, you know, something's not quite right here.
Yeah, the old report, yes. The
Yes.
Carter study.
Yeah, that one, and then the one that Elizabeth did, where she did the comparison to show that it really did not benefit
Yes.
the rural counties.
Yeah, that was based, yeah, they did a cross-reference based upon the data from that study, the Cutter study, the first study.
Yeah, and I think that really made a big difference when somebody really looked at it and said, well, you know, this might not be, you know, the best option for us, and we need to do something different.
Right. What works for us is that because we help a large number, I mean, we're the biggest agency, and even with all of this, we do get the lion's share of the trip and equipment allocation for the year. But what they do is that, you know, over time, they keep chipping away. You know, there was a period of time where we were, you know, at over $8 million, $9 million, and they've been cutting and modifying it where we're at a disadvantage on mileage because our program is relegated to public transit and fixed route. And so fixed route cannot be included into that formula. So this formula is a formula that takes into percentages of different components. One is the population, one is the trips, the mileage, and then other little factors. And so what happens is our formula, we're only using like 3 of the 4, or, you know, of the four components of that formula. And so again, we're not able to use, and how Dr. Tellez had mentioned before when Robert spoke, that our program is not ADA. We're fixed route. We're a, you know, path program for a fixed route. So, you know, we're being vigilant just in case that, you know, they propose some models, and in all the models we lose. There's one where there's one that we're, you know, 2 that we lose big, and then there's one that we lose, you know, not as much, but all 3 we lose. So we're being vigilant. We're monitoring, and we're participating. You know, Robert Villar from our department, you know, our assistant director, he is, you know, he's on this, and he's monitoring, and he's participating in all the meetings, and we're being vigilant about this matter.
Yeah, I can't remember when I first came on. It's been almost 4 years that's when the big cut came.
Yes, they got us, yeah. So we're, you know, again, this is the beginning of the process, and, you know, I could work with Janine, and we'll, for the next LCB meeting, we'll add a, you know, a component where, you know, I can provide an analysis of the study. You know, I can provide something even beforehand. You don't have to wait for the next quarter. I can provide something for Janine to distribute to the board members, you know, in the next week or so, that details what the study is, and to provide a link, so that, and the information for the next workshop. So they'll have an idea of what the study's about. They'll have the link, and they'll have the opportunity to participate should they wish to participate. Okay?
Okay, thank you guys.
No problem.
Thank you, Dr.
Thank you,
Tellez.
Mia.
You got
Thank you,
it.
Dr. Tellez. Pleasure to hear your voice. In a time when we need diversity and inclusion, that is the queen of diversity and inclusion. Thank you, Dr. Tellez.
Absolutely.
Let me ask Mia something. What is the current shrimp grant amount right now?
It is 6.9 million. It is the same allocation because of this whole COVID thing. They and the CTD decided to just allocate what they allocated last year. So we have the allocation that we received last year. And we got a little bit more because we got, from the voluntary dollar, we got a little bit more cash from the voluntary dollar from the prior year. So, but basically we got the same allocation that we did last year, which was about 6.9 million. And then with our share, with our public, our match, it's about
Local match.
over 7 million. So we got the same allocation as we did last year. So we're okay for right now, and we're slowly building up. But yes, we have to be vigilant about this allocation formula.
Yes, and I think at least I know I will. I'll be looking forward to what you sent me because I think
Got it.
Mr. Villar will speak on behalf of the CTC, but there should be some public input from citizens of Miami-Dade County as well, and that would be us board members. Just to explain to some of the new board members, because this gets a little complicated in that the TD in the state has a big trust fund. They get money from the license plates and other things that go into it to build this TD trust fund. And then through trip and equipment grants, they dole it out to the different counties. Miami-Dade County, being the behemoth that it is, at one time was providing way over half of the state's TD trips. Half of the entire state of Florida's TD trips were right here in Miami-Dade County. Obviously, some of the other counties, when you're fighting for dollars and state dollars, they've always tried to trip up Miami-Dade County's allocation, which was a pretty large allocation. And systematically, it's been they've been working on it. First, they no longer recognize the fact that we have a massive ADA program called STS. And since that was a sponsored program, we can no longer count all those STS rides, even though the program cost this county upwards of $40 million a year. They also went into did I put Mia to sleep that she fell asleep? I think we lost Mia. She's fallen asleep. I am so boring. All right. Oh, we got her. We got her. Oh. Anyway, they're always chipping away at Miami-Dade County is what I'm trying to get at. So sometimes we gotta put the gloves on and fight back to make sure we can garner every dollar we can from the TD Trust Fund, because we are providing mounds and mounds of transportation disadvantaged trips in this county that don't even get counted by the state. So that was my point on that. So I would look forward to getting that information so we can attend that meeting.
Perfect.
Any other business? Any other business beforehand?
No.
If not, it is 2:43. I want to really thank everybody for this endeavor. Everybody, I hope everybody is safe. All lives matter. We pray for everyone, and everybody be safe out there. And with that, we're adjourned.
Thank you.
Thank you, everybody.
Thank you, everyone.
Bye, everybody.
Thank you.
Be well.
Thank you.
Bye.
Bye-bye.
Thank you, everybody, for joining. And
Thank
we keep this alive. We keep it alive, even under COVID.
Thank you.
Thanks.
Thanks.
Bye now.